Welcome to the presentation on Hernando County, Florida. The above referenced topics will be objectives this presentation will cover. Hernando County is located on the northwest side of Florida, approximately 1 hour from the Tampa International Airport. The climate is mild and attracts many snowbirds from northern states and abroad. The history of the county begins in 1840 when Fort DeSoto was established in what is now present-day Hernando County. The area was named after the Spanish explorer Hernando de Soto in 1844. The housing structures in the area are adequately built, affordable, and well-maintained when compared to similar housing units in Pasco and Citrus counties. Homes are predominantly single-family block homes built in the 70s with a modest architectural design. Let's now discuss other structures in the community. Hernando has a wide array of places to worship. There are 2 modern libraries in the county. Hernando also features various recreational facilities. The Weeki Wachee Park is a state-owned park which features live mermaids, swimming, and daily entertainment venues. One deficiency the author of this presentation noted was a lack of fine art exhibits in the community. The county population has grown by 1% in the last 3 years. A deficiency which may be noted is that the county does have a disproportionate amount of people older than 65 years of age. The American Journal of Public Health reports increasing trends in emergency room response times due to an increase in seasonal populations. The seasonal population for the county is reported to increase by 22% January through May, and emergency room wait times increased by up to 20 minutes. The county data parallels the information found in the American Journal of Public Health 2014 report. When analyzing the data researched, it is evident that the community is predominantly white Caucasian with little racial diversity. The Caucasian population represents 78.1% of the county, while 22% represents Hispanic, Black, and Asian persons. The author of this presentation would also like to indicate there is only one ethnic food grocery store in the community. The data suggests that Hernando County has a much lower educational income level when compared to the mean income and education level for the state of Florida. Evidence-based practice suggests higher education and income are related factors to a thriving, healthy community. Hernando County has adequate healthcare access, acceptability, and affordability programs. There are 2 main hospitals in the community, which are Oak Hill Hospital and Brooksville Regional. Access to the hospitals for those who do not drive is convenient. The bus has direct routes to both hospitals. The county has 5 walk-in clinics and numerous nursing home facilities which offer specialty services. The county also offers addiction and mental health counseling services. Many programs are free. The most prevalent cause of death, according to the County Vital Statistics Report, in order of occurrence were cancer, heart disease, chronic respiratory disease, and stroke, and unintentional injury. Heart disease and stroke was chosen as a #1 objective for this community as cardiovascular disease is a leading cause of death. The county has an abundance of fast food establishments which may be attributing to the increase in heart disease, stroke, and obesity. Despite research gains in treatment of CVD, this disease remains the leading killer of women and disproportionately afflicts racial and ethnic minorities in Hernando County, according to the American Heart Association 2013 report. Tobacco was chosen second and represents the 3rd leading cause of death in the community. In 2013, 47% of the community reported that either they currently smoke or did smoke within the last year. The CDC reports health risks are associated for smokers as well as for non-smokers. The county health department reports chronic respiratory diseases have increased 7% in the last 2 years. Environmental health was chosen 3rd due to various types of chronic respiratory diseases found in the community. Substantial increases in environmental tobacco smoke exposure is associated with low birth weight and sudden infant death syndrome. In the county, the infant mortality rate in 2013 has been attributed to external environmental exposures. Hernando County, Florida Air Quality Information Index 2014 report indicates that Hernando scored a 93.79% in good air quality. This number represents a higher air quality rate than Pinellas, Pasco, or Hillsborough. Hernando County Public Water Supply draws public water from different well locations. Strict routine water sampling at each well is performed on a monthly basis. The county does have adequate public transportation services for residents. Bike paths are safe and well lit in most places. The Tampa Bay Regional Airport, Brooksville's only airport, offers daily commuter flight service, however, does not offer commercial airline service. This may be considered a deficiency in the community for persons who travel frequently abroad. Commercial flights are available at the Tampa International Airport, which is only a 1-hour drive from the Brooksville area. The county crime report has been on shows a steady decline of 5% since 2012. With the combined Brooksville Police Department and Sheriff's Office presence, the public has a sense of security in the community. Hernando County Emergency Management Services features a website for the public to access, which includes evacuation routes and emergency medical quick tips, emergency shelter locations, and animal shelter services. The Brooksville Police Department, which is the primary law enforcement agency within the city limits, reports an average response time of 18 minutes in the rural part of the county and 12 minutes in the city limits. The fire department response time was reported to be 8 minutes in 2014. The response time is a deficiency in the community. The deficiency is partially due to conditions of roads. The 2015 county agenda includes 7 road renovation projects, which should facilitate police and fire response times. There are nuisance animals in the community, with coyotes being the most prominent. The county commissioners are voted into office by the public. The elected term is 2 years. However, officials may be reelected up to 4 terms. The official duties for the position include providing a safe and healthy community environment while creating new strategies for growth. When speaking personally to County Commissioner Diane Rowden, it was evident community officials are very responsive to public inquiry, and there is little or no concern that public funds are used inappropriately or wastefully based on county official interviews and while attending county meetings. Hernando County, like most counties, features a wide array of fast food establishments. Because of the 24-hour convenience of these fast food restaurants, the county has a high rate of cardiovascular disease and obesity. The county is deficient in health food stores, vegetarian restaurant options, and lacks fine dining restaurants. Hernando County does have a problem with meth labs in rural areas, according to the Sheriff's Office crime report. The recent boarding of vacant foreclosed houses and buildings along with community policing has decreased the drug dealing hangouts and ease of purchasing drugs on the street. Tobacco usage continues to be a problem, especially with persons under 18 in the community. The 6 overall health community needs in the specific order are: number 1, healthier eating establishments due to the abundance of fast food restaurants and increase of cardiovascular disease. Cardiovascular disease is one of the community's leading causes of death. Additionally, child obesity has increased by 12% since 2012. Number 2, tobacco education. 47% of persons in the community either smoke or did smoke within the last year. Cancer is the number 1 killer in the community, with lung cancer being one of the top 3 cancers. Diabetes education represents the 3rd health need of the community. Diabetes rates at number 5 for the most common cause of death in our community. Environmental protection is number 4 and is a concern, with chronic respiratory disease rating number 3 as the leading cause of death in the community. And number 5, health screening. Many people can avoid malignant neoplasms by simply taking advantage of community health screenings. And finally, number 6, reduction of stress. The stressors of everyday life can be better managed with time allocated for family and friends. Evidence-based practice suggests by reducing stress, addictive tendencies may be decreased. The county health department reported that children who are considered obese rose 12% in the last 2 years. Because heart disease is on the rise, nutritional educational services are now provided in schools, and lunch programs are offering healthier food choices. Exercise programs are being reintroduced into daily school curriculums, and employers are offering exercise incentives. From a global standpoint, efforts to reduce cooking with saturated oils and limiting supersized food choices have proven to be effective weight control options in countries such as France. The French magazine Le Monde Diplomate reports an effective response to combat the obesity epidemic, which includes cooking foods with more nutritional oil substitutes, reducing food portions, growing sustainable foods, and reducing the flashy packaging of carbonated drinks, attractive to children. As a nurse in the Hernando community, with the abundance of farmlands and with the active participation from the local agricultural extension office, farmers could receive incentives to grow crops and the public could be invited to purchase vegetables and fruits fresh daily from farmers. This would be cheaper than purchasing healthier food from big chain grocery stores and would support the local farm economy. Plus, packaging costs would be saved, which in turn would benefit our environment. While flashy packaging and the reduction of saturated fats may not be completely adopted by all school programs, the ideas France has employed to save their children from heart disease is worth exploring. As a nurse in the community, healthier food purchasing options will encourage both healthier living and will allow for family time, which too will encourage overall better habits. When one visits Hernando County, the strengths of the community are evident. Although there are a few shortcomings which can use improvement, the overall community is adequate and growing. Families are enjoying the outdoors and people are taking a more active role in exercise and enjoying nature. The health of the community relies on our government officials to make programs accessible to all people. Staying healthy affects the economy both locally and globally. It is the author's hope in this presentation that Hernando County was recognized through this presentation for its community involvement, new health promotion strategies, beauty, and peaceful nature allure. Thank you for your interest in viewing this PowerPoint. A complete list of references is attached separately for review.